Here, how are you?
Good, how are you?
Good, just using some Purell here for my hands. Well, nice to meet you. I am Brenda Echeverria. I'm going to be your nurse practitioner today. Can you state your full name and date of birth?
Lindsay Fenwick, 11/13/88.
Okay. So you're here for a physical exam. We're going to look at your respiratory system, your cardiac system, your abdominal, and your peripheral vascular, okay? Do you have any concerns or questions about anything right now that you want to address?
No.
Okay, so looking at you right away, I mean, you seem oriented, you're alert, you're looking at me, you're tracking me, you look like you can hold your balance pretty well, you look, well nourished. I'm not seeing any signs that there's anything distressful going on. I did check your vitals, the tech before, took your set of vitals, everything looks great, your heart rate's normal sinus in the 70s, your blood pressure is great, it's like a 124/80, perfect. Yeah, and your oxygen's great, you can't get any higher than 100%, so yeah, you look good. All right, so we're gonna start with the respiratory system.
Okay.
So looking at you, I'm looking at your chest rise and your shoulder rise with your breathing. Everything looks symmetrical. You don't look like you're in any kind of distress at all. I'm noting your respirations, how fast you're breathing, how slow you're breathing. You look like you're comfortably breathing. You don't look like you're under any distress, or your effort is, there's no work of effort. It's quite easy for you to breathe, right? I am looking at your lips, looking for cyanosis. So your lips are nice and pink. You have a nice color to you. You're not pale or bluish at all. I'm going to take a look at your fingers real quick. Your nail bed, there's no clubbing to your nails. Your nails are nice and a regular form and shape. They're nice and pink. They're not bluish or anything in nature. What else? I'm just going to look at your neck and your upper chest area. So take a deep breath in and out. So I'm not noticing any kind of retractions at all. In your inner spaces, I'm just going to kind of look behind here. I'm not seeing any kind of retractions at all on your back side. Your accessory muscles, I'm not noticing that you're using any of those extra muscles to help you breathe. Okay, so your trachea. Your trachea is nice and midline. You have these two muscles here, your sternocleidomastoid muscles. So I'm just going to palpate in between your trachea and those muscles, that space there, to make sure they're both symmetrical, which those spaces are good and symmetrical. What else? So I am not hearing any kind of audible wheezes or anything from you, or any like weird sounds as you're breathing. I am looking at your thorax. So I'm looking for any kind of like abnormalities, any bone protrusions anywhere, any lesions or sores, redness, rashes. Just gonna come to the back here and do that. Of course, I would have you in a gown, and I would expose your entire back when I'm doing this. And then I'm going to compare the antero-posterior diameter to your lateral diameter. So I'm pretty much just checking to see if everything is proportional. So I'm going to look from the front and the back. And I'm going to have you lift up your arm for me. Okay, good. And I'm not seeing any kind of like barrel-chested or any kind of flail-chested, anything abnormal going on. All right, and you're like, it's like a 2-to-1 ratio, pretty much. And then I'm not really noticing any kind of impaired respiratory movement at all when you're breathing. Okay, any shortness of breath at all? You
Nope.
experienced anything? Okay. So now I'm going to palpate, okay? So I'm just gonna kind of push down here on the chest. Let me know if anything feels, I'm sorry, my hands are cold.
It's okay.
Anything's tender at all?
Nope.
Anything hurts at all? And I'm going to do the same thing with your back. And again, I'm kind of looking at your skin at the same time, making sure there's nothing abnormal or outstanding with your skin at all. I'm going to chest for chest expansion. So, you know what, I'm going to have you slide this way. I'm so sorry. All right, so I'm going to come down here to the bottom of your rib cage here. I'm just going to kind of pinch in just a little bit. I'm going to have you take a deep breath in and out for me. And one more time. Okay, so good. So there was equal expansion on both sides. It wasn't like you had a shift. One was higher than the other. They both kind of, both sides of your lungs kind of went up at the same time. And I'm going to assess for diaphragmatic excursion. So it's pretty much, I'm just going to measure how much your diaphragm moves up and down when you take a deep breath in or deep breath out. Okay. So I'm going to do the one side here first. So actually, I'm going to just palpate first on the back side, and then we'll do that, okay?
Okay.
So I kind of found where your diaphragm is just as you're resting. And can you put your arms up kind of in front of you?
Okay.
Yep. Thank you. Okay. I kind of heard your diaphragm kind of resting is right here. So now what I'm going to have you do is I'm going to have you take a deep breath in and hold it for me. Okay. Breathe normally. Okay, so now I'm going to have you take a deep breath in and out, and then hold it out. Okay, you can breathe normally.
Okay.
Okay. So I'd say it's about 3 to 4 centimeters is what it's at right now.
Okay.
So I'm going to test the other side now, okay? So take a deep breath in and hold it. Okay, breathe normally. And then I'm going to have you take a deep breath in and exhale and hold it out. Okay, you can breathe normally. Again, it's symmetrical on both sides. It's like 3.5, 4 centimeters.
Okay.
Okay, perfect. I think that's it for right now on the back side. You can put her right there. All right, so we're gonna do something called tactile phrenitis. So it's just gonna let me know if there's any kind of consolidation, fluid pockets anywhere. So I'm just gonna have you say 99 when you feel my hands on your back. Okay?
99, 99, 99, 99, 99, 99.
Okay. So I'm gonna have you turn to the front. And I'm going to do the same thing.
Okay. 99, 99, 99, 99, 99, 99.
Okay. And then I'm just going to percuss the front side now. And again, I'd go underneath your gown. So now I'm just going to listen to your breathing, okay? And if you can breathe out your mouth, and every time you feel me move the stethoscope, take a deep breath in and out.
Okay.
gonna come underneath here.
Mm-hmm.
Okay, I'm gonna give you a break for a minute so you don't end up passing out on me.
You doing okay? Yep, okay.
All right. So I'm gonna do the same thing on the back.
Okay.
Every time you feel me move the stethoscope, go ahead and take a deep breath in and out for me. And I'm pretty much just listening to airflow in your lungs, making sure you're hitting all the lobes, with adequate, airflow. I'm listening for any kind of abnormal sounds, any bronchi, any crackles, any wheezes, anything like that at all, okay?
Okay.
Okay, so what I'm going to do next is just a couple of voice transmission tests, and I'm just going to have you say a couple words here or there
Okay.
as I'm doing this. So again, when you hear me move the stethoscope, I want you to say the word 99 for me.
Okay. 99, 99, 99, 99, 99, 99.
Okay, so that was testing for bronchophony. Next is egophony.
Okay.
So I'm going to have you say the letter E.
Okay.
All right.
E, 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 E.
Okay, and the last one, if you can just turn just a little bit.
Yeah.
I'm so sorry. Is going to be the whisper pectoriloquy.
Okay.
So I'm going to have you whisper 1, 2, 3 for me.
Okay.
Okay. All right, great. Thank you. You can step forward if you want.
Okay.
So then I'm going to have you also do coughing, a couple coughs.
Okay.
Sometimes after you give a good cough, sometimes people can get kind of some crackly sounds. So I'm just going to make sure that you don't have that.
Okay.
Go ahead and cough for me. Can I do it again? Again. I didn't hear any of that. So
Okay.
good. All right. So yeah. I didn't, notice anything, outrageous or abnormal with your lung sounds at all. Normal expansion in and out. Everything was clear throughout. So good.
Okay.
All right. So next we're gonna do your cardiac assessment. Okay.
Okay.
All right. Move on to your cardiac exam now. We're going to look at your carotids, okay? So I'm not really seeing anything bounding or anything like that, like real big strong pulses. I'm just going to feel for them right now, okay? Okay, nice and strong. Nice and strong. So then I'm just going to listen for bruise. And I'm going to have you hold your breath for me, okay? Okay, breathe normally. Hold your breath. Okay, thanks. I don't hear any kind of bruise or anything like that. So I didn't feel any thrills or anything. It was just a nice strong pulse that you had there, and they're equal on both sides. So now I'm going to check for jugular vein distension. And again, I don't see like any veins that are just like bulging out of your neck or anything. So what we're going to do is I'm going to have you lay down.
Okay.
Okay. Okay. You can see it. Okay. So I'm going to have you turn your head to one side. Okay, perfect. And can you turn your head to the other side? Okay, perfect. Okay. So let me get my ruler. All right, so I am just kind of looking for a little bit of a pulse here, which I do right here. Okay, it's very slight. So I'm just going to put this ruler here on the sternal angle here. And then at the highest point of that pulse, I'm going to make my line. And it's about 2.5 centimeters. Okay, perfect. All right, so then what I'm going to do is I'm going to look at your pulse of maximum impulse. Okay, that would be down here. Okay, so you know you're in a gown and everything. I would lift up your shirt and I would look to see if I could see that pulse, and then I'm going to palpate. Okay, I'm just going to come up underneath your brow line. And a PMI is mid-clavicular line, 4th, 5th intercostal space, kind of right underneath your breast here. Okay, I feel it. It's a nice, gentle, kind of soft kind of pulsation. There's no double beats or anything like that that I'm feeling at all. Okay. And if I couldn't feel it, I would have you turn to your left side and try to feel it that way. And I could also try to percuss to try to find it also. But like I said, I could feel it right away, so I'm not going to do that. So then we're going to palpate for the aortic arch. So I'm going to come up here just right of the sternal border, 2nd intercostal space. Okay, and then this is your aortic, and I'm going to go over here to the left side of your sternum, 2nd intercostal space. Feel for your pulmonic artery. Okay, so then I'm going to come down here to the 3rd, 4th, and 5th intercostal space on the left side of your sternum. Just looking for the systolic impulse for the right ventricle, okay? I'm sorry if this is not hurting you at all. You're okay? All right. Okay. So then what I'm going to do is I'm going to listen to all of your valves at the different locations on your chest. All right, so I'm going to listen to your aortic valve. All right, your pulmonic valve. Your Erb's point. All right. And your tricuspid. And then your mitral, okay? So really, I'm just trying to see if I hear any kind of murmurs, any abnormal sounds at all, any extra beats here or there, but really I'm looking for that swooshing sound to see if you've got any murmurs. So now I'm going to use the bell of my stethoscope, and I'm going to listen to the apex of your heart, okay, which is that bottom kind of portion of your heart. So I didn't hear any kind of extra sounds, no extra S3, S4 extra beats or anything. I did not hear any murmurs also. So now I'm going to have you sit up, and then using the bell on my stethoscope, I'm going to have you lean forward. And then I'm going to have you exhale for me. Okay, great. You can breathe normally now. Sorry, thanks. So if I did hear any kind of abnormal sounds like a murmur or a swishing sound, I would want to note the timing, like when I hear that swishing sound, where I hear it the loudest in the different areas that I listen to. I would want to note the intensity of it and any kind of pitch or quality that's associated with that too. Okay?
Okay.
All right, so we're done with cardiac. We're going to move on to the abdominal assessment now, okay?
Okay.
All right. All right, so Lindsay, we're going to go do the abdominal assessment now, okay? So first I'm going to inspect, okay? So I'm just going to lift up your shirt here, okay? So I'm looking at symmetry. I'm looking at the contour of the abdomen. So is it protuberant? Is it swollen? Is it swollen on one side or the other? Is it concave? Flat? So I'm not noticing any abnormalities. I'm looking at the skin. I'm looking for any distended veins. I'm looking at any discolorations, any striae, rashes, any kind of lesions, anything abnormal, which I don't see. And next, I'm going to look at your umbilicus. So it's not swollen, it's not bulging, it's not reddened or inflamed at all. And then I'm looking for any kind of waves of peristalsis, which I don't see that either. And aortic pulsations, I'm not seeing anything bounding at all on your abdomen, okay? So I'm going to listen now, okay? I gotta listen for a good 1 minute in each spot, okay? It's gonna be a long minute. Sorry. Are you hungry? Did you eat breakfast this morning? I did? Okay, are you sure?
I had a
'Cause
Starbucks
I
sandwich.
hear a lot of activity in there.
Well, it's digesting.
Well, if you hear it, you know I hear it. Okay. All right, I hear some really good bell sounds.
They're putting on a show for you right now.
They are. They're showing off. All right, so I would listen to at least 1 minute in each of the.
I'm so sorry.
Fine, no. Your bowels work, it's good. All right, so,
They can buy here and over there too.
right? Okay, so bowel sounds are good in all 4 quadrants. I'm going to listen for any bruits over your aorta. Okay, so I'm looking for your xiphoid process and your belly button here. So I'm just going to kind of go kind of halfway in between. don't hear any bruit at all. So now I'm gonna listen for if I can hear a bruit over your renal arteries. Okay. I don't hear anything on the left side, on the right side. I don't hear anything on the right side either. So now I'm going to see if I can hear a bruit in your iliac arteries. Okay, so that's below your belly button, kind of on the angle towards your femoral artery, which is down here. I don't hear anything on the right. I don't hear a bruit on the left either. Okay, and then I'm going to try to find your femoral artery. And then I would listen to see if I could hear a bruit. Again, you'd be in a gown, you'd be disrobed, you'd be covered enough to let me go down. Okay, so I don't hear any kind of bruit in any of those areas, okay? And then I'm going to listen to the right side over your liver, and then I'm going to listen to the left side over your spleen. Just looking for any hums or any friction rubs at all, anything like that, okay? I don't hear anything abnormal, no hums or anything like that, no friction rubs. So now we're going to percuss. So we're just going to percuss the 9 areas. Your abdomen is kind of broken up into 9 different sections. So I'm just going to lightly percuss all those 9 areas, okay? Okay. Any tenderness at all anywhere?
Nope.
Okay. And then I'm going to measure the liver span. Okay, so I'm pretty much going to go right mid-clavicular line, and I'm going to start kind of like underneath your breast area and go down. Okay. I just wanted to grab some more gloves here.
Okay.
Okay, sorry. All right, so liver palpation or percussion. So liver span. We're going to start just under the breast here, and we're going to palpate until that resonant sound turns to dullness. Okay. About right there. I did find it actually. And then I'm going to start with your belly button, and I'm going to work my way up. Okay. Yeah. I don't know, 5, 6 maybe centimeters. Okay, that's your liver span. Okay. And then I'm going to palpate your or percuss your spleen. So I'm just going to come over here on this side, the anterior axillary line, down here. And do me a favor and take a deep breath in. Okay, great. So I still heard quite resonant sounds over here. So your spleen is not enlarged, your liver is not enlarged either. So good. So now I'm going to palpate. Okay, so you did say that you didn't have any abdominal tenderness at all. So I just wanted to be careful those areas if there was. Okay. I'm just going to lightly palpate your abdomen. And let me know if at any time it starts to feel tender. No? Okay. All right, so now I'm going to go just a little bit deeper, about 2 inches. Okay. So doing okay? Okay. So now I'm going to push in and kind of let go real quickly. You let me know if you have any pain anywhere, okay?
Nope.
Okay.
Nope. Nope. Nope.
Okay. All right, so we did that. That would be rebound tenderness. And I didn't feel any kind of masses as I was palpating around. But if I did, I'd want to make a note of the size, where it's at, how hard does it feel, is it pretty solid and stationary, or does it move at all? Okay. All right, so now we're going to palpate for the liver's edge. Okay, so I'm just going to kind of hook my hand around back here to kind of help support your rib cage as I kind of push down a little bit. I'm not really feeling anything protruding or anything like that. Okay. And then I'm going to feel for your spleen, okay? Again, I'm just going to support your rib cage with my hand here. Okay, I don't feel any swelling or anything like that going on over here. Okay, and then I'm going to palpate for your kidneys, okay? So again, I'm just going to support the back of your back with my left hand. Any tenderness at all? Okay. And I'm going to palpate the left kidney over here. No tenderness at all? Okay. Doing okay? All right. So the aortic width, I'm just going to come on each side here and just kind of, I need a stool to get up here to get a good angle. Maybe like 2-3 centimeters, maybe. I'm not feeling any like pulsations or anything like that. Okay. I am going to test for ascites, if there was ascites, which you don't have any, no swelling of the abdomen or anything like that. But if you did, I would want to percuss, starting at the top of your belly, and I would percuss all the way down to the side. And I would note when that resonant sound turned dull. Because that would mean that's where the fluid is at. After doing that, I would have you turn to one side, and then that fluid, if you turn to your left side, that fluid would be kind of hanging down to the left side of your belly. So then I would start percussing here to the right, working my way down, and kind of noting where that resonant sound turned dull. You don't have any ascites, so I'm not gonna do that.
Okay.
Appendicitis. So, if you had appendicitis, there's a couple of things that I would test for. The first thing is Rovsing sign. So appendicitis, you would have some pain over here in the right lower quadrant. Rovsing sign is if I palpate down on the left side, you would have that referred pain over here to the right. Okay. Do you have any of that?
No.
Okay. Another test that we can do is if you would to lay on your left side.
Okay.
This one's psoas sign. So I'm just gonna have you straighten out your legs. I'm gonna just support your hip here. And then I'm gonna bring your leg kind of back. I'm just gonna bring your leg back, yep. And then kind of try to bring your leg forward for me. Do you have any pain in your belly?
No.
When you do that? Okay, perfect. So that would be negative for that. You can lay back and back now. The last one is the obturator sign. So you would flex your leg here, and then I would internally rotate your leg. And if you had pain down here, that would be a positive sign for appendicitis. You don't have any pain there, do you?
No.
Okay. Cholecystitis. So any issues with your gallbladder, I would, it's called Murphy's sign. So I would kind of palpate down where your gallbladder is at. And then I would have you take a deep breath in. You took a deep breath in just fine. If you had something wrong with your gallbladder and you did that, you took a deep breath in, you would have that, like I can't take a deep breath in anymore because there's so much pain. So that's the Murphy sign. And lastly but not least, we're going to assess the costovertebral angle for tenderness. So I'm going to have you sit up and put your legs this way. Okay. So this would be, I'm looking just, below your rib cage here. Okay. And then I'm going to put my hand kind of right here on your lower back. And then I'm going to just lightly tap with my fist. You let me know if you have any kind of pain at all, okay?
No.
Okay. I'm going to come to the other side.
No.
Okay, perfect. So you're negative for any kind of issues, with your kidneys. And that concludes, I think, this part of your examination. We'll just get ready to do the peripheral vascular assessment, okay?
Sounds good.
All right, this is the last of your assessments. It's the peripheral vascular. Okay, so I am just going to look at, starting first with your hands all the way up to your shoulders. I'm going to look at your hands here. I'm going to know if there's any swelling, symmetry, size of your arms and hands. I'm looking at your fingers and your nail beds. There's no clubbing at all. If I go ahead and pinch your fingers here, I'm just checking for good capillary refill. It's less than 3 seconds, so you have good blood flow to your fingers here. I am noticing the color of your skin. I am noticing the temperature of your skin, so I'm just going to kind of, and again, you would have a gown and you'd have all your skin exposed for me to view. And I'm noticing also your veins. So anything like really protruding. I'm looking at good vasculature, which you do have. Okay. And then I'm going to do the same thing, but with your lower extremities.
Okay.
So again, I would note, you'd be in a gown and you'd have your skin and your extremities within the viewing. Okay. So I would be looking at the symmetry of your legs. I would be looking at any swelling that you might have all the way down to your feet, ankle area. I would be noting temperature-wise, so I'd use the back of my hands to kind of feel your skin with the back of my hands on the front, the back, and the sides of your legs. I would note, I'm sorry, I'm going to put your legs down for a second here. I'm so sorry.
No, you're okay.
So I would note the distribution of your hair. So with your shin area, I would notice, you shave your legs. Yeah, okay. So do you normally have hair on your legs?
Yeah.
Okay, so that's a good sign. We want hair on your legs. And your feet, and your toes. I would also check for capillary flow on your toes. So I would check the circulation to each of your toes here. And you have good blood flow as soon as I release that pressure. I would also look to the backs or the bottoms of your feet, make sure there's no sores or anything like that going on. Skin-wise, I would be looking generally just for any lesions, rashes, bruising, any hyperpigmentation, hypopigmentation, any issues like that. You haven't noticed anything anywhere?
No.
At all? Okay. So for palpation-wise, I am going to take your arm here, and I am going to feel for your radial pulses, okay? So, is it okay?
Oh, yeah.
Thanks. Thanks. All right, so I'm just gonna feel for your radial pulses here. I want to make sure that I can feel them bilaterally and that they're equal, and they are, they're +2. And then I'm going to feel for your brachial pulses here. All right, that's nice and good. +2 for your right side there, +2 for your left. And then I'm going to assess for your ectropiorals. So those are up here in your upper arm. So I'm going to have you extend your arm 90-degree angle, and then right at the bend of your arm, I'm just going to go about 3 inches in between your bicep and your tricep. And see if I can feel those, which I don't, but I would be assessing for if they're, if I can feel them, if they're swollen, if they're squishy, if they're mobile, but I don't feel them, so that's good. And then I'm going to do the same thing on this side. So I'm going to go 3 inches in the bend of your arm there. Okay, I don't feel anything in there either. Okay, good. And then I'm going to have you stand up real quick. So again, you'd have a gown and you'd have your legs exposed for me. So I would be looking for any kind of varicosities that you might have, any like spider veins, anything like that. I would be looking at the back of your legs, the lateral side of your legs, and front of your legs, and I'll be doing that to each leg. Okay, you can go ahead and sit down. So now I'm going to put on some gloves. Okay, so let me just pure out my hands real quick. Again. Great. Okay. That's always great trying to put on gloves when your hands are just a little wet. All right, so I'm just going to have you lay down for me.
Okay.
I'm going to extend this out. So, wearing gloves because I'm going to palpate for your femoral pulses. Okay. So I want to make sure that they're both equal. They're great pulses +2. And then you have some inguinal nodes that kind of travel up, and you got some that travel down. So I would palpate up to see if I feel anything swollen, inflamed. Nothing's tender at all, is there?
Nope.
Okay. Which I don't feel anything. All right, so I'm going to assess your popliteal pulses. All right, those are +2. And your pedal pulses are on the tops of your feet here. Okay, and then your post tips are back here on the inside. Okay, great. So I'm going to have you sit up now. Okay. So swelling. I didn't notice any swelling on you at all. Okay. But if I did, so sorry.
That's okay.
If I did notice some swelling, I would want to note, how bad is that edema? So I would go ahead and I would kind of push down for about 5 seconds. And then after 5 seconds, let up and just see, how long it takes for that to go back to normal. But again, you don't have any edema at all. And I would check the tops of the feet, and I would also check the shins for that edema, but you don't have any, so that's good. And then just a couple other special tests. So it's called the Allen test. It's just to check for patency of your radial and your ulnar arteries. So I'm just doing one at a time here. So I'm gonna hold pressure down on your radial and your ulnar artery. Make a fist for me. All right, open it up. And it's nice, it's white, so now I'm gonna release. And now you have that flow. All right, so we know that your ulnar artery is patent. So we're gonna do that one more time. Open it up. And now I'm gonna release the radial artery. And you should have that pinkness, which you do, so that's good. All right, so now I'm gonna do the same thing on the other side. And open your fist. And now you have that pink. So you know that your ulnar artery is patent. And we're gonna do that one more time, just to test for the radial artery. And open your fist, okay. And I'm gonna release pressure, and now it's pinked right up. Okay, perfect. The last test is for arterial insufficiency for your legs. So we want to make sure you have good flow to your feet. So I'm sorry, I'm going to have you lay back down, and I'm going to hold your legs about 60-degree angle or so, okay, for about a minute. Your feet should become a little on the paler side. And then after a minute here, I'm going to have you sit up, and we're going to dangle our feet down, and then your feet should pink up within 10 to 15 seconds. So we've done this for a minute. I'm going to go ahead and have you sit up. And yes, see, your feet have pinked up beautifully. Okay, all right. I think that is it for our assessment. I think we're all done. Do you have any questions or anything?
No.
No? Okay. All right.
Thank you.
Yeah, thanks.